So today our topic is concept of causation. So whatever the name is telling, concept of causation means हम लोग disease की बात कर रहे हैं. तो how the disease is caused. So supernatural theory of disease जो कहती है that says कि जो हमारा disease है that is contagious. Contagious means it can come from one person to another, right? And there are many theories जैसे theory of humors, miasmatic theory, theory of spontaneous generation. ये various theories हैं जो कि लुइस पास्चर थ्योरी से पहले आई थी, राइट? सो जर्म थ्योरी ऑफ डिजीज जो कहती है दैट इज कि देयर शुड बी सम और द अदर डिजीज एजेंट that should be the culprit who is sending disease or who is sending symptoms to human being. ठीक है, like the disease which is caused to the human being, some or the other cause should be there, and particularly या mainly cause जो होता है वो कोई ना कोई causative agent होता है, either it is the bacteria or it is a virus, parasite or something else. ठीक है, so there should be some diseased agent. बट जर्म थ्योरी का जो लिमिटेशन है दैट सेज कि all individuals those who are exposed to certain disease agent जिसको हम पैथोजन भी बोलते हैं, इट डज नॉट डेवलप अ डिजीज लाइक ट्यूबरक्लोसिस. ठीक है, लेप्रेसी, लाइक इंक्यूबेशन पीरियड होता है एंड समटाइम्स द पीपल आर एसिम्टोमेटिक. ठीक है, देन कम्स सोशल एंड एनवायरमेंटल फैक्टर्स लाइक पॉवर्टी, माल न्यूट्रिशन, ओवर क्राउडेड एरिया में एक रिसाइड करना. तो दीज आर सम ऑफ द थिंग्स और एनवायरमेंटल एंड सोशल फैक्टर्स विच येस आर द कॉजेज ऑफ डिजीज, बट इसमें देर इज नो पॉजिटिव एजेंट, देर इज नो डिजीज एजेंट, राइट? देन for the infectious agent also, agent and illness are unreliable. One to one relationship जो होता है that is unreliable. Means the things can pass on, the diseased agent can pass on from one person to another, and it is not necessarily कि that one person and another person should have the relationship like we saw in the COVID, है ना? Then comes epidemiological triad. The germ theory is foundational. ठीक है, is foundational means it holds a very good position when we are talking about the concept of causation of disease, but there are some limitations. So when the limitations comes, then the people or the epidemiologists started working on this. So we have a broader model of disease says कि agent भी होगा, host भी होगा and environment भी होगा. So there is an triad. ठीक है, एजेंट मीन्स द कॉजेटिव एजेंट, वो बायोलॉजिकल भी हो सकता है, केमिकल, फिजिकल, न्यूट्रिशनल, मैकेनिकल, एनी टाइप ऑफ एजेंट. होस्ट इज द ह्यूमन बीइंग and the environment means the external conditions or the environment in which the human being is living, plus the time can also be the uh, one of the agent or one of the causative factor, right? That time is added in the expanded models later in the models. So time means exposure, timing of exposure and duration of exposure. Like if a person is asymptomatic or the person is having a agent which is means non-symptomatic or non-contagious, or it is in the dormant stage, then it will not shed, right? Like in viral diseases, the virus is not shed unless and until it is in the active stage. If it is in dormant state, it will be in dormant state, it will not pass on from one person to the another. Then the incubation period is what? Incubation period is the time when the disease agent went enters into the host body until the time the symptoms come to the host. So that is the incubation period. Okay, and the illness progression means sometimes it becomes the chronic disease, and the chronic disease sometimes it is not contagious. So these are some factors. Particularly the triad covers agent, host and environment, but the added expanded models also considers the time, which is also a factor for giving a disease. So we'll study one by one the agent, host and environment. So when we talk of agent, the agent can be infectious or it can be non-infectious. So agents which are infectious are bacteria, virus, parasites, fungi, molds, while non-infectious agents are chemicals, radiations, that can be heat also, nutritional deficiencies, and it can be some type of poison also. The host is, yes, the human being who is getting the disease. We are talking of the human beings. So some pathogens can survive in specific host conditions, some cannot, right? So the disease can develop only if it met certain conditions, like what is the immunity level of the human being, what is its genetic makeup, nutritional status, what is its exposure level, and overall health and fitness also is considered when we are talking of the host who can have multiple disease or who can be who is getting the disease. Next is the environment. So environment includes biological environment, physical environment, social and cultural environment. So we can say the environment can be external and the internal. When we talk of external environment, that is the surrounding and the community or the livelihood that we are living in. Internally means the body of the host. Body of the host means what is the immune status, what is the gut flora, what is if it he's working like overall health and fitness of the person. So that is considered the internal human body system, right? And when we talk of biological, physical and social cultural factors means biological means presence of vectors and reservoirs means bacteria, virus, parasites and all. Physical means what is the climatic condition, what are the sanitation and housing conditions of the person. And social cultural means the customs, crowdiness and the healthcare access provided to the human being. Next comes the time. We are talking of the time also. So we, as I have told you before, incubation period, that is time between exposure and the symptom onset. Duration of illness, how long the disease is to the human being. Threshold of epidemic means, is the disease spreading widely in the population, is it highly contagious or not. Plus life expectancy of host or the pathogen. Sometimes the pathogen uh, it remains asymptomatic and it ultimately goes off, like it is the certain life period. Like we know that flu takes 5 days, simple cold takes the 5 days, मीन्स हम कितना भी मेडिसिन खा लें 5-6 डेज से पहले हम ठीक नहीं होते हैं. तो इट इज़ अ सर्टेन लाइफ टाइम ऑफ दैट पैथोजन और द सर्टेन पीरियड ऑफ टाइम जो हमारा डिजीज रहता ही रहता है. ठीक है. Then comes different theory, that is multifactorial causation. Multifactorial causation may the people or the epidemiologists like Pettenkoffer says that there is no single cause. Like germ theory says कि बैक्टीरिया रहेगा, वायरस रहेगा, पैरासाइट रहेगा, right? Means there is some microorganism which is causing the disease. Okay, but Max Pettenkofer says कि no, there is no single cause model. Diseases such as cancer or coronary heart disease or chronic bronchitis or mental illness, there are several diseases which has multiple causative agents or multiple causative factors which are behind the disease, right? So we all know कि अगर कोई हार्ट का प्रॉब्लम है तो देर कैन बी द कोलेस्ट्रॉल लेवल्स, देर कैन बी द ट्रॉमा एंड द स्ट्रेस लेवल्स, there can be hypertension causes. So there can be multiple causes behind the disease. Then we talk of multifactorial model as given by Max Pettenkoffer. So he says there are various factors and it is a complex interplay among them. So we talk of biological means the human body, the genetic predisposition, the immune system, then the behavioral pattern of the person, that is he smoking, what is his diet, is he doing any physical activity or not, then is he socializing, means what is his educational status, what is his income status, what occupation he is in, then the environmental conditions what he is living in, pollution, housing, sanitation, psychological stress, coping mechanism of the body, then the beliefs and customs and health practices that are being practiced by the person. So multiple risk factors also contribute to the high fat diet, then tobacco use, sedentary lifestyle, obesity, hypertension, elevated cholesterol. So there are multiple risk factors which give rise to a particular disease. Now what is the role of epidemiology or the epidemiologists? So epidemiologists not look only to the microbe which is causing the disease, or only the one causative agent, or only the one cause that is causing the disease, but they look beyond the microbes, that what are the life circumstances of the individual, and what, in what conditions, in what community he is living in, that is causing or that is affecting his life, or what is causing the health status of his body. Then multifactorial approach integrates various elements and it expands to the non-infectious conditions also. So non-infectious conditions are particularly the lifestyle factors or the lifestyle diseases and certain injuries that they have to think of. Then instead of focusing only on the agent, they have the multiple causative factors, they work on them. So what is the importance of identifying multiple causes? It helps in quantifying the risk. It helps in prioritizing interventions. Interventions means the treatment and the management of the disease. They are supporting the prevention strategies which the individual should take to prevent the disease. It enables customized care based on particular individual, encourages policy level changes to address the root causes. And what is the benefit? Benefit means it is applicable to today's health challenges, promotes holistic understanding of disease, offers multiple entry points for prevention and control, and yes, of course, it bridges the gap between clinical medicine and public health, right? So this is the multifactorial paradigm, benefits, multiple causes, and the epidemiological triad which is causing the disease. Now if we talk particularly of the web of causation, so we see there is certain model, like we'll understand it with the help of a model, like disease which is not resulted from a single cause, instead it is a network of contributing factors. So these factors interact among one another. Like in this case, if we talk of this example, we are talking of mental illness, right? Or we can also talk of STD and HIV diseases, right? So if we talk of these two things, somewhere or the other, self harm, interpersonal violence, human trafficking, adverse childhood experiences, historic trauma, imprisonment, substance abuse, addiction, social isolation, poverty, low educational attainment. These are all the multiple factors which are causing mental illness to the human being. Or it can also be said the STD has multifactorial factors which can be all of these, right? So this is the web of causation. Means there is no single cause, there are multiple factors behind any disease. Then the interconnected risk factors, just we are explaining this model for the exam point of view, like for the purpose of writing, like what are the interconnected risk factors. Interconnected risk factors means each factor in the web are is linked to each other. They are forming the chains, they are forming the loops. Example, if there is malnutrition, there would be weakened immunity, and there would be increased susceptibility to infection, and it can be any infection, that it can be bacterial or viral or parasitic, any. If the person is having stress, he'll have the poor sleep, there would be hormonal imbalances, and it will result in a chronic disease, right? Then there are certain misconceptions also. Misconceptions are means they are clarified by the web of causation. Means not all contributed the factors they are eliminated, right? So the misconceptions are clarified means the web of causation does not imply that all contributing factors must be eliminated. Means to control the disease, all factors should be eliminated. If we are cutting the chain, if any of the factor from the chain or the loop of causation is broken down, the disease will fade. In many cases, removing a single key factor can also reduce the disease risk. What I said, that not all the elements carry equal weight, means some can be primary causative agent and some can be secondary contributors or the risk factors of the disease. So, what are the implications for public health? Implications of public health means what is the requirement in public health to study this epidemiological triad or the factors. It helps in identifying the intervention points. Intervention points, where should we manage? What should we manage? What factors should we hold on to reduce the disease risk, right? Or to control the risk of the disease. It also supports multidisciplinary approach to prevention involving medical, social and environmental strategies, and then it encourages prioritization of high impact risk factors. So this is all the implication of for public health when we study the concept of causation.